Hello there, welcome to another episode of Putting Dr. G on the Spot. In the month of October, we've been focusing all our effort on awareness of breast condition. And what we want to do this week is actually focusing on the most important and most serious condition that affect the breast, which is breast cancer. Traditionally, we talk about breast cancer as far as women's concerned. However, 1% of breast cancer happen in men. So believe it or not, the breast tissue in men can also induce breast cancer. This is predominantly happen in several individuals, and that will include men with high family history. For example, men who has got BRCA genes in the family can actually more predispose them to prostate cancer and also breast cancer. Other type of men might actually have such condition will be men who suffer from a congenital condition called Klinefelter. With Klinefelter, this is genetically more susceptible. Other men such as testicular failure and also hormonal derangement as a result of liver failure. And all these is to do with hormone. When the hormone change, if someone is more susceptible to breast cancer, then although how small the breast tissue there is, it will undergo changes and that will predispose to cancer. And the symptoms will be similar to women. It will start with a lump that is palpable, later on some secretions or bleeding and even retraction of the skin. And in the late stages, you might even find lymph nodes around the armpits or arm swellings. And obviously, these are all very scary. If the condition is discovered in early stages, just like in women, then the disease is completely curable. However, when the disease is traditionally more discovered in much later stages, then the prognosis is much worse. Because men don't expect themselves to encounter problem with breast cancer, therefore awareness like this is crucially important for men occasionally just to do self-examination, because 1% is also a risk of getting breast cancer. Typically, the operation itself to remove breast is called mastectomy. But in men, since there are not a lot of tissue to actually cause a reconstruction, therefore a modified mastectomy is required. Following that, there may be radiotherapy plus or minus hormonal therapy such as tamoxifen. With such complete treatment, most men will recover quite well if the condition is discovered early. For the following week, we're going to talk about breast pain. This is a condition called mastalgia. So when the breast is painful, there must be a reason behind that. Let's find out next week what is causing breast pain in men. Stay tuned for next week's Putting Dr. G on the Spot.